Welcome to Medical Matters Weekly with Dr. Trey Dobson, presented by Southwestern Vermont Healthcare and Catamount Access Television.
Welcome, everyone. Today is July 27th, 2022, and we are recording a show for next week, August 3rd. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth Health, and this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. My guest today is Dr. Jennifer Davis, who is known to many as Dr. Jenn. She is a critical care pediatrician and board certified in lifestyle medicine. Jenn, welcome to our show.
Thank you. Thank you so much for having me.
And I have to tell the audience, we just jumped online, we just got ready, and I found out that Dr. Davis is residing right now in Bennington. So tell us a little bit about that.
Yes, I recently moved. I moved to Bennington actually in December from Florida. I have two college-age children, and they decided that they wanted to go to school in the Northeast. And I decided that it would be better for me to be closer to them. So we started looking for places, and we found Bennington, and we love it. So been here since December.
Well, welcome. I'm so sorry that I'm just now meeting you, but I can't wait to meet you in person rather than video, and we can do that offline and get to know one another, and as well as introduce you to the medical community and the community here at large that you maybe not had the opportunity to meet since you've been here. Real quick on Dr. Davis's background, she earned her undergraduate degree in philosophy at Wellesley College, which I am fond of because my wife attended Wellesley, earned her medical doctorate at New York Medical College, and completed pediatric residency at Westchester Medical Center, earned a fellowship in critical care at Montefiore. I'm not saying that right. Say that again. Montefiore. Right? Montefiore Medical Center in the Bronx, and then earned a plant-based nutrition certificate at the Colin Campbell Center for Nutrition Studies. So tell me, and then finally earned a board certification in lifestyle medicine. What is a plant-based nutrition certificate?
It's exactly that. It's basically a study of everything plant-based. So everything from the food politics to all the nutritional benefits of a plant-based diet and how that can apply to a many number of clinical situations. So
that's great. Okay, so I'll stop talking here a little bit. And Dr. Jenn, we'd love to hear a little bit about where you're from and eventually how you came here, I guess, to Bennington.
Okay, I'm initially from New York. Actually, as you can tell, I did my training and everything there. I grew up there. And then after my fellowship, we moved to Fort Lauderdale, where I lived for about 20 years. I worked at a county hospital there, Broward Health, in Fort Lauderdale, in the Pediatric Intensive Care Unit. And then just most recently, we moved here in December. I am now doing per diem work for Fort Lauderdale and now pursuing full-time lifestyle medicine. So
that's great. So you're not gonna be practicing pediatrics. You've been there, done that, moving into lifestyle medicine. How did you get interested in lifestyle medicine?
Well, it happened. Actually, what happened initially was I was interested in vegetarianism, I guess, for the planet. And we actually did a 28-day challenge, my family, and did a plant-based challenge. This was about 12 years ago. And at that time, Forks Over Knives, the movie, came out. And when we did the challenge, we felt amazing. I also, at around that time, I started doing kind of intensive exercise, doing more ultra distance pursuits. And I found that I was recovering so much better. I felt great. And then I watched Forks Over Knives, and I was amazed that I had never learned any of this in medical school. In medical school, I learned so much about the biochemistry of nutrition, of macros and protein and fats and all of that, but nothing about the benefits of plant-based nutrition. So then I kept researching more, and I did the plant-based nutrition certificate. And then I discovered actually lifestyle medicine as a specialty. I was looking for something that, where it was mainly focused on actually preventing disease and using nutrition as a tool. And that's how I found lifestyle medicine. And so in 2019, I became board certified.
That is great. So tell me about what your ideal practice would be.
Well, my ideal practice would be all encompassing. So right now what I'm doing is a health-based practice, but ideally I would love to have a lifestyle center where we address all of the chronic diseases, any disease, and where there is exercise physiology available, where there is some mental health support available, and mainly focusing on plant-based nutrition in a teaching kitchen and just the whole all-encompassing lifestyle interventions in one place. And I think offering a group-based approach as well, which is beneficial because then everybody helps each other, and you get the benefit of seeing other people's success.
Speaking of success, just tell like some of the audience who may not be familiar with lifestyle medicine. And by the way, we've had several guests who practice lifestyle medicine. You may have looked that up, but help our audience understand, what type of patients that you do see currently, and what type of support you provide to them.
So right now, I've been dealing with patients that have type 2 diabetes or pre-diabetic, and also patients that have had cardiovascular disease. And the main approach is like using the pillars in a therapeutic manner to treat this. And the pillars of lifestyle medicine include plant predominant nutrition, restorative sleep, stress reduction, exercise, encouraging healthy relationships, and then also avoidance of risky substances, which include alcohol and smoking. It's from there. And so basically writing a prescription, going over patients and working with them, going over the history, going over what they've tried before, going over, what works given their family environment, their social environment, all of that, and coming up with a plan together. And it's more a coaching. So instead of giving a directive, it's more coming up with a solution together and developing SMART goals and helping them achieve those. And
tell us what you've seen as far as, okay.
So it's pretty amazing. I mean, I've helped many people reduce their medications. I've had several people that have come off of antihypertensives, been able to come off of their oral hypoglycemics, reduce cholesterol, so maybe not come off all of their medications, but definitely reduce in that case. And that's amazing results. Definitely so powerful, so much more powerful than I ever imagined, and very rewarding.
Right. For the audience, I think the audience knows this, but I just want to make sure they understand, especially today, physicians that are prescribing medications for example, we'll just use for hypertension, are not intent that medicine is the only answer. It may be a start while you're working on other aspects of lifestyle to help with that, or it may be an adjunct if you just need a little push. But physicians don't want you to be on medicines; they prefer you to not be on medicines. And any thought that doctors just want to prescribe medicine is not correct. At least not today. At least not in our generation.
Absolutely.
Dr. Davis is an example. But sometimes it takes effort, and it sometimes takes effort more than an individual busy primary care physician can offer. And that's where Dr. Davis and many other types of services can lend that support. Working with your primary care physician. So tell me what's different about a plant-based diet from a vegan diet.
So vegan is the absence of animal products. So that would be not including honey, not including anything, eggs, dairy, and it can include processed foods though. So Oreos are vegan. So,
right.
But so a plant-based diet is a more whole food approach. So the goal is to have the least processed form of food, and also excluding. So as if you talk about plant predominant, it doesn't necessarily completely exclude animal products, but maybe very minimal amounts of animal products. But again, the goal is focusing on whole unprocessed foods. And
you did a super job of explaining that difference, better than I would have done for sure. Thank you. And you've been working with some recipes yourself. Tell us what you've got in the works.
Yeah, it's fun because I do have, like I said, teenage children. So it's always a challenge to keep them excited about plant-based nutrition. And so I'm always trying to change over, something that's traditional, especially my son who is more difficult on that realm. So some of the things, like last week we had plant-based crab cakes, which jackfruit and Hosser palm is the substance of it. I make things like, I make a lot of Italian dishes also. I do have, my husband's Italian. So like lasagna with a plant-based twist. So using, instead of using whole milk ricotta, using cashews or even almonds as the ricotta. a whole host of mushroom dishes. Mushroom dishes are a lot of fun for me because you can use those to mimic a lot of different traditional meat dishes, I guess. But I like to, when I make meals, this was part of like when I made the transition, is instead of thinking of it as a traditional, like a standard American meal where you're worried about, you have like the meat, the meat, the starch, and the vegetable, I look at it as making a variety of different sides so that it kind of changes the way you're looking. Like you don't have to have that main protein portion because everything has protein in it. So it's just really, you want to eat a variety of things every day to make sure that you're getting the full complement of nutrition.
So what advice would you give to someone who's listening and saying, I really want to try this. I have friends that have been successful. My family's a little resistant. The last time I tried, I went all in and I just drove my family crazy. What's a good approach? Sounds like you've had a little experience of that yourself.
Right. I mean, I try, so it's be open, be flexible. That's the first thing. And it doesn't have to be all or nothing. That's the other thing, is a lot of people think it has to be one way or the other completely. And when we did the transition, so my children were, I guess, 7 and 9 when we did the transition. So that is already a challenging age, which getting children to eat healthy, and then doing this big lifestyle change was a challenge. But again, I made a variety. Like when I would make dinners, I wouldn't make 2 dinners. I would make a variety of different vegetables and sides for my children so that they would have an option of choosing different things, one thing. And I would, in the beginning, was making meat at home still. That's since within a couple of years stopped altogether. So we don't cook, we cook plant-based at home. And then the other thing is let children participate and let the family participate in choices, like what are their favorite dishes? And then you can make a transition, a conversion to something a little bit healthier or more plant-based version of that. The other thing is with children is letting them, again, help you cook is one thing. Let them choose like the ingredients and, come up with something fun with the ingredients they choose. And just, involving the family in it really is one way to help. And then, again, making it not so rigid, letting them have, some options. So, and then I was going to say one other thing is just to keep offering. So a lot of times children will say, no, I don't like it. They refuse it many times, but they have to taste it. Sometimes they say 20 times or more before they, develop a taste for it. So don't throw it out before giving them ample opportunity to adjust to it.
Right. Mm-hmm. So keep at it. That's one of the
exactly.
Tell me about some challenges you've had with patients, not only necessarily related to diet, but just in lifestyle medicine in general. You're speaking to most right now through telemedicine, and almost like you and I are talking right now, right?
Yes, exactly. I think the biggest challenge is, that one thing is getting the buy-in from the family, or if they are not the one doing most of the cooking, or if the family's resistant to it, that's hard. The other thing is a lot of people don't realize how large an effect stress has on them. And especially in the last, several years dealing with the pandemic, in addition to all the other stressors, that has a huge effect on your health. So you can be eating right, you can be exercising, but you can continue to have problems with weight or cholesterol or hypertension because the stress is not under control. So managing those things is important.
You've started something, Walk with a Doc here in Bennington. Tell us about it.
So Walk with a Doc actually is an international organization that was started by a cardiologist who recognized that he wanted to get his patients moving. So I started in Florida when I initially was there as a critical care physician. That was one way I could get involved with lifestyle medicine and help, provide a service to the public. So basically it's a free doctor-led walk. We do a little topic, various different topics. Like last week we talked about heat resistance and hydration. We talk a little bit about nutrition. So we choose a topic and do like a 5-minute talk or so, and then we walk. And it's all ages, all exercise levels. So everybody's invited. And again, it's free. And it's a great community building activity as well. So
how would listener to the show get involved? Where would they meet, or what would they do?
So we've been doing it at the Mile Around Woods in North Bennington.
Mm-hmm.
So the first and third Saturdays of the month, and they can go to my website or Well, go to my website and there's a Walk with a Doc link. You can click that, and that's where I update the walks every, whenever they're happening, if there's any changes. So
That's great. So what's your website?
Oh, it is healthylivingwithdrjenn.com.
All right. And we will put that in the show notes as well. healthylivingwithdrjenn.com. If I say that enough, then I'll remember it. That's fantastic.
And Jenn has two N's.
Jenn has two N's. All right. But in addition to walking, you're into running. Tell us how you got into running.
Well, I was looking for an activity that I could do anywhere, anytime, just required sneakers. And that's kind of really just how it started. And in medical school, there was a group of us that started running. It was a great stress release, a great way, community activity that we could, plan races. And then it kind of grew from there. After I had children, it was just, again, something easy to just pick up and do. I could throw them in the stroller and get out. And then I just got more and more interested and involved, started doing marathons, and then became interested in what was after a marathon. And I found out about ultra marathons. And so that's now my passion. So,
do you have any upcoming this fall or late summer?
My next ultra is going to be December. I did have a little sabbatical. I actually had my hip replaced, so I'm still recovering. Wow. Well, I'm not recovering, better now, but getting back to my previous level. So I'm registered for a 100-mile race in December. So.
Oh, that is fantastic. We will be following you. We will give updates to our audience. That is fantastic. Tell us, as we're sort of closing out here, what are you looking forward to over the next, let's say, 2 years, both personally and professionally?
So professionally, I hope to grow my practice and spread the word and continue to educate people about the power of lifestyle medicine. That's really, I want more people to know that how powerful a tool it is, and really can be the primary treatment in almost every disease. So that's my big goal right now. And then I guess personally, I have some more ultra adventures that I would like to pursue of longer distances. That's like a big goal of mine.
No, that's great. And I assume that the audience, people that actually would like to not only connect regarding the walk, but potentially have a consult, can they do so through their physician, or is it better to reach out to you directly on your website? They
can reach out to me directly. I don't do primary care. I only do lifestyle medicine. And right. So that, they can reach out directly to me through my website. Yeah.
That's great. Hey, thank you. Thank you so much for joining us today.
Absolutely. Thank you so much for having me.
So I'd like to thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, Ashley Jowett from Southwestern Vermont Healthcare. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we will see you again next week.